little more simple. Now, what usually happens in regards to thoughts or emotions or behaviors is there is a three model, phenomena that we follow, where we divide the whole brain into a conscious, a subconscious, and the unconscious state. Now, suppose you guys are looking at me right now, and there is something else in the background, or there could be some disturbance coming from somewhere, or there could be something happening around you. Now, all these informations is being retrieved by your brain. Your brain is not just trying to retrieve what Dr. Virinchi here is saying, but your brain has the potential to decide what is important or what is the priority right now. So the rest of the things that your brain feels that is not really priority, it keeps them stored in your subconscious state or in your subconscious brain. So there's a lot of information inside your subconscious brain. Now there is, all this information at some point or the other wanting to come into your conscious brain. But we have a lot of security checking happening. And now this security check will try to decide which thought should be coming into your conscious brain. Why does your security check do that? Because the security check somewhere decides that probably this particular information that is in the storeroom right now, which is wanting to come into the living room, that is the conscious brain, could be negative, could be useless, could be triggering a bad emotion, could be making him behave in a different way. So that's why the security check tries to stop you, or to stop those thoughts coming into the conscious brain. But unfortunately, in some situations, this security check fails. And when the security check fails, a lot of these negative information comes into your conscious brain. Now, while I say, we cannot control the thoughts because it's in the hands of the whole security check that is happening, let us see what best we can do. Well, with this little controversy in your head right now, let's try to get into the topic today Rishika wanted me to talk about. So, well, she said, doctor, talk about managing anger. She said, understanding what will I be talking today. Understanding and then I thought, okay, since it's 20 minutes, talk about processing sadness. So let's try to understand negative emotions at this point. So an emotion is something that is triggered by something that is external or something that is internal. When I say internal, it can be a memory. A memory can trigger an emotion, or things happening around me. I see somebody, falling off a bicycle. That triggers an emotion. I see somebody, smiling at me. That triggers an emotion. I see my favorite star performing on the stage. That gives me an emotion. I look at my report card. That gives me an emotion. So somewhere, these emotions are those lower level responses that happen inside the brain. Now, what happens when these emotions or these lower level responses get triggered? They go and activate some chemicals inside the brain. And these chemicals are really necessary for the physical state of the body. So there is a happiness chemical. You start feeling happy, you start feeling calm. There is a chemical in relation to anger. So there is a different feeling in the body. There is a chemical in relation to anxiety. Your heart starts beating faster, you start sweating all over, there's difficulty in breathing, the typical anxiety symptoms. So somewhere emotions are triggered by all of these. So emotions are generalized. Emotions can be the same in everybody. When you're anxious, when I'm anxious, the same kind of response happens. When you're happy, when I'm happy, the same kind of response happens. But now when we come to a concept called feelings, so feelings are a little more subjective. There is something sad that I remember, but I can give a socially acceptable feeling to it. So I remember my granddad who's no more. I don't need to burst out crying right now. I can just say to myself that it's okay. I had some good time with him. It's not right to always feel bad. Instead of thinking about the sad part, let me think about the happy times that I spent with him. So feelings are a little more subjective. And now When we talk about negative emotions, a lot of people ask, if negative emotions are really bad. Not really. I mean, I don't think negative emotions are always bad. Now let's take an example, of an empty glass in your hand and there is a jar full of water. You start pouring that water into this glass and the glass fills till the brim. At this point, there is water overflowing from the glass. Now, the same water which is inside the glass is useful. The same water that has overflown is useless. So, similarly, these negative emotions, when are at a particular level, at the level inside that glass, they could be useful. Like, let's see, I mean, when you're anxious, you read more. Let's try to take an example. All of us as students, 1 month before the exam, probably we were reading, 3 questions a day or 4 questions a day. 15 days before the exams, we were reading 2 chapters a day. 5 days before the exam, we were reading 3 chapters a day. One day before the exam, we tried to read the whole book. And 30 minutes before the exam, somebody came and told you that, probably there's a question coming from this chapter and you did not read that chapter. So you end up reading that whole thing in 30 minutes. So somewhere that negative emotion of anxiety has helped you or pushed you to do better. Similarly, be it an emotion of sadness, you get your report card and then you see less marks. There's a lot of sadness which could be stimulating you to do better next time. You're angry about something and then you want to work on it. Somebody's made a bad comment on you, you get very angry and then you decide, let me prove them wrong, and then you start working very hard and you prove them wrong. So somewhere these negative emotions to an extent are helpful in improving your personality, increasing your performance, making you work more hard. Then why are we always cribbing about these negative emotions? Well, what we need to understand is every time there is a negative emotion, like I told you, in the beginning, that every time there's an emotion, there's a chemical release happening. So now a negative emotion has been scientifically proven to release a particular chemical called cortisol into your body. Now, this cortisol is actually a bad hormone when produced excessively, because every time your body releases cortisol, there could be some level of damage that could be happening. Well, cortisol has a bad effect on the entire body, starting from head to toe. A lot of us complain that, I'm stressed, I'm having graying of my hair. That's because of cortisol. We say, I'm stressed, I'm losing my hair. That's cortisol. People put on weight because of stress. That's cortisol. Cortisol can rather even reduce your immunity. Rather, that's the reason, during this whole pandemic, WHO has been clearly saying that do not take a lot of stress because that's going to reduce your immunity. So, somewhere, what we are worried about a negative emotion is the excessive cortisol production that could be damaging the body. Otherwise, negative emotions are something that could be helpful. So, a brief about negative emotions is what we need to understand is these emotions trigger a chemical reaction inside the body, and these chemical reactions are the ones that decide the physical state of you in that particular situation. Well, let us try to talk about one of these negative emotions, that is anger, because that's one of the topics, that is managing anger. When are we actually angry? you know uh, Probably, when we try to look at anger, I think there are four situations where I felt a person could be angry. A person could be angry when he wants to hurt himself, or rather when he's angry he wants to hurt himself. You're disappointed with yourself, you're very angry, and then you decide, no, I'm going to end my life. He wants to hurt himself. You're angry when you want to achieve control over something. there is somebody who's trying to dominate you, and you want to very angry with their behavior because they're not letting you to be yourself. That is when you want to take control. Maybe to feel powerful. To feel powerful, there could be that anger inside you. Probably in a similar situation, like I was telling, you have a dominating friend, you have a dominating spouse. You feel that you're losing control over yourself. You feel that somebody else is controlling all your activities. You get very angry. And then to fight for injustice, when you feel something is morally not going according to what you feel, you suddenly get angry, and you want to jump into the situation and work upon. So when you talk about anger per se in psychiatry, we try to divide anger into a neurotic anger and a psychotic anger. Before I confuse you all with these words, neurosis is a state where the person is aware of what is happening around him. Psychosis is a state where the person is not aware about what is happening. So we are not talking about a psychotic anger. A psychotic anger is there in a bipolar patient, is there in a schizophrenic patient, is there in somebody who's intoxicated. I'm not talking about that anger. I'm talking about situations like I was telling, where you feel that, you want to harm yourself. That is because you're sad inside. You want to achieve control because you're disappointed inside. You want to feel powerful because again somebody is being discriminating you and making you feel less or low. When you want to fight for injustice, when you feel you're morally right and somebody is wrong. So if you frankly look at anger in a neurotic state or in a normal state, I would like to recall what Sigmund Freud says about anger. Sigmund Freud says anger is nothing but a suppressed sadness. So in our clinical practice also, a lot of times we see that somebody, maybe a child who's 16 or 17 is being brought up to the hospital, and the parents say that the complaining issue is his anger. They say he's very angry, he's irritable, he tries to answer, answer back in a different tone. And at the end of the diagnosis, we get to know that he is actually feeling sad, and that sadness is being expressed in the form of anger. So different personalities show up their sadness in different ways, and one of the ways is anger. So a lot of times when we meet somebody with anger, we should not be saying that this anger is a part of his personality, or this anger is something that is coming out from pampering of his family, or his anger could be a cause of arrogance. It need not be that way. Just like how somebody can cry when they are sad, somebody can even be angry when they are sad. So these are rather a few atypical symptoms that we see in somebody who is depressed. So now a few personality traits which provoke anger is, somebody who has a personality of, controlling. We call them as controlling freaks. They want to control everything happening around them. I want to like get up in the morning. I want to, rush to the hospital, and I want to finish my workout. And then I want to come back and do this session. And then I want to go back and see patients. I want to like control everything happening around us. But is that really possible? No. So somewhere when you are unable to control a lot of things happening around you, you get angry, you get frustrated. And, there are martyrs, where, I'll give you an example of a girl called Sarah. So Sarah keeps on feeling that she should be doing everything that comes to her head. I should go to this party because my friends are going to feel bad. I should be inviting them home back because they invited me. I should be calling them and doing so and so. So when you have that tendency or a personality trait of feeling that you should be doing everything, otherwise somebody is going to feel bad. At some point you might not be able to do, and because you're unable to do, you start feeling bad, you start feeling guilty, you start feeling that probably somebody is going to take you wrong, and that comes out in the form of anger. And some personality traits where they are victims. A wife who has a dominating husband who does not let her do what she wants. He made her quit her job. He made her change the way she dresses herself. He told her not to talk to a set of people because he doesn't like them. Somewhere at this point, she starts feeling unhappy with herself. She starts feeling that she does not have a life of her own. And at this point, the expression of her frustration or the sadness inside could be in the form of anger. So every time we speak about anger, we need to understand that there is an underlying emotional sadness that could be coming out in the form of anger. Well, again, like I told you in the beginning, there are conditions where anger per se is a presenting factor. But we are not talking about that here. We're talking about generalized anger, which is not sustained for a very long time. When you want to make a diagnosis of somebody having anger, per se, you have to look at a criteria where this anger is present throughout the day on everybody without any logic. We are not looking at that way. I'm looking about the expression of anger which all of us here felt at some point. So what I'm specifically saying here is this anger could be because of an underlying sad state. Now, when I'm saying a sad state, what usually happens with sadness is what we need to understand. There could be a lot of causes which could be making us sad. But if you look at the third topic that we are talking about, processing sadness is actually something which is exactly which is important. And this is something that a lot of us don't know. So if you are getting confused from which topic we are going to do, what I'm trying to club all the three topics, if you see, I'm trying to club what negative emotions can be. Out of these negative emotions, we're talking about anger as an emotion. And this anger need not always be per se an anger expression or an anger feeling that we have. This anger could be a state of sadness which is being expressed in that form. And why is that sadness being expressed in that form? Because we are unable to process our sadness. Now, what really happens is a lot of times when you're sad, you do not know what to do. And now what happens is a person tries to escape from this sadness. He could be, going into drugs. He could be going into distractions which are unhealthy. And somewhere we try to, probably, mask the sadness for a while, but we are not dealing with the sadness here. And this is where I think therapy or medication or behavioral changes come into play. So now when we are talking about these negative emotions or anger or sadness, let me bring in the concepts of dealing with it. You might be asking me right now that in the beginning you said we cannot control them, and now you are saying that let's deal with it. We still cannot control our thoughts, but there are methods by which you can find out an alternative way of thinking. There is a method by which you can process these thoughts into a much more meaningful manner. And that is where I think, mental health professionals, psychiatrists, psychologists, counselors, all of us come into play. So now going back to the first concept of what we spoke about, a chemical reaction happening. As a psychiatrist, I see everything as positive chemicals and negative chemicals. I see things as serotonin, dopamine, norepinephrine. When somebody comes and they start talking to me, I realize that there is less of serotonin in him. There is less of dopamine inside them. I think what they need is endorphins. I mean, that's how our brain works. Uh, so I always try to tell people, when somebody comes to me with a breakup, I give them some suggestions, and a lot of people have told me, after talking to you, you are so unemotional that we started feeling that we don't really need a relationship right now. And I think that's how it works. Somebody comes to me and says, I have a breakup. I had a breakup, and now I'm missing that partner. So I try to explain them that what is missing is not the partner, but what is missing is the dopamine inside your brain. And the best part is your brain doesn't know if the dopamine is coming from your partner or if the dopamine is coming from dark chocolate. So you give a lot of dark chocolate and your brain starts accepting it, and your brain starts feeling happy. Your brain has the ability to move away from that sadness. So bringing into the chemicals here, what we usually believe is the brain has the ability to stay happy to stay calm, to stay positive, to stay energetic, to stay enthusiastic, to think positive, even in regards to future. And all of this that the brain, I'm talking about the capacities that the brain has, can be achieved even in an unfavorable situation. Let me give you a very basic example what we are going through right now. In the month of March, there were 500 cases of COVID-19 positive all over the country. And all of us here were sitting in the house wearing masks. Today's date, there are 25 lakh cases of COVID-19 all over the country, and all of us have started going out. What do you think could have changed? In these few months, your brain, which already has the capacity to adapt to a new unfavorable situation, has adapted. And that is the reason all of us have started coming out. So now, how is this ability to adapt to a new situation coming into the brain? That is coming because of some chemicals being produced. So these are the chemicals: serotonin, dopamine, norepinephrine, endorphins. These are all the positive chemicals. So now, when these chemicals are there, why is the brain becoming negative? That is because at some point, there is a halt in the production of these chemicals, or there is a reduction in these chemical levels. So what we believe is the positive chemicals should always be a step ahead than the negative chemicals. At some point, because of excessive stress that you're taking, or somewhere because you're not able to manage your life, or because of unexpected events coming into your life, this negative hormones or chemicals are increasing into your body. And now the goal or the key is to bring back the positive chemicals. What are the ways of bringing back these positive chemicals? Well, as a psychiatrist, science, what I believe or I read, speaks about medicines. A lot of people ask me, why medicines? It's all inside the head. It's not inside your head. It's all inside your brain, and what is inside your brain is these chemicals. And now you need to bring back those chemicals, and medicines undoubtedly are one of the best means in bringing back these chemicals. So now with the medicines, you try to bring back these chemicals. Are medicines the only way? No. Therapy. When we talk about therapy, I would like to talk about CBT here, a cognitive behavior therapy. The concept of cognitive behavior therapy again works upon bringing back these chemicals into the brain. So if you look at a behavioral therapy, all the activities that we bring upon helps in bringing back these chemicals into the brain. And once you bring back these chemicals into the brain, that is where the cognitive therapy comes. So what is cognitive therapy? We are helping you identify what the negative emotion inside you is. We are helping you identify how you can change that negative emotion. And then obviously dietary changes and social support, family support are the ones that help you in bringing back these chemicals also. So now, before another 5 minutes, I would like to end, talking about the ways you have to deal with these negative emotions. So before I get into the ways, let me do a quick backup. I'm talking about emotions. I'm talking about feelings. We know that feelings are a little more subjective, and these emotions are bringing some chemical changes inside you. These chemical changes are deciding your physical state. And when we are talking about these negative emotions, they're not always bad, but because they're bringing in negative chemicals, we need to keep them at, a control. One of the negative emotions we are talking about is anger. Anger need not always be the sadistic anger that we are talking about. Anger could be because of an unresolved sadness. And we need to resolve that sadness to automatically bring down that anger. We always fail to resolve sadness because we try to escape from sadness. So now one of the best ways to deal with this sadness other than the medical management is, one, I think we need to start accepting our state of mind. We need to start accepting that we are sad and this is an emotion. And we need to firstly accept that what we are right now is not what we truly are. I could be sad, But that's not what Virinchi is. That is a particular phase of my life because of some events happening around me. So once you start accepting that there is sadness, there are different ways on working upon these negative emotions. Some of these ways are: one, physical activity. You might be talking, when somebody is sad, where does physical activity come into place? Now, unfortunately, like I said, we need to understand that bringing in happiness is not in your hand. That emotion is not in your hand. But bringing in what your brain needs for that happiness is in your hand. So your brain needs positive chemicals, which can actually be delivered to the brain through a physical activity. That's the reason most of the times physical activity is, prescribed by most of the doctors. Second important thing is meditation. And when we talk about meditation, I know a lot of people talk about mindfulness meditation. So, mindfulness meditation is about being aware of what is happening in the present. Now, if you actually look at what anxiety or what sadness is, it's about my thoughts going into the past where I start feeling this could have happened in a different way. I wish things could have been different. And I start feeling bad. Or rather, I'm anxious when I start thinking about future. What am I going to do? How will I do it? Will I be able to do it? Now, if I can distract myself from both these ends, that is the past and the future, and stay in the present, you actually create happiness. And to do that, mindfulness is an important practice. So, in mindfulness practices, we deliberately teach somebody to stay in the present. Couple of minutes, Rishika, 1 or 2 minutes, I'll wind up. And then, when we are talking about mindfulness, there have been studies which spoke about why mindfulness is important, because there have been experiments where people trained with mindfulness when they were shown a sad event, when they were shown a sad movie. Their analytical mind did not work more, but that part of the mind which was looking at solutions, which was looking at how to move away from this, which were looking at how to solve this particular issue, started working better. So that is why mindfulness plays an important role. When you look at the definition of health, we talk about physical, mental, and social well being. These are the three aspects that are actually failing, or one of the three aspects is actually failing, which leads somebody into a continuous state of sadness. And working upon these three aspects, be it the physical health, be it the mental health, and be it the social health, are actually extremely important to bring you out from these negative emotions. I would still say the statement that I said initially. Your thoughts, your emotions are never in your control. They are being controlled by different things happening around you. But it is important that you know that there are ways that will help you to bring you out of this. And those are the ways through which you are actually boosting the neurochemicals related to happiness, related to calmness, which are endorphins, serotonin, dopamine, and bringing about this change is what helps an individual to come out of negative thoughts or a negative emotion or an emotion of anger or an emotion of sadness. Well, with this, I would, like to cut my topic here. I'm sure, I did raise a lot of controversial questions, and that's what I intended to do so that we can have more discussion. Uh, and
Thank
I'll surely pass it over to the next speaker, Nishtha Narula.
Yes, thank you so much, sir. Without any further delay, we would just like Ms. Nishtha Narula to take over the stage. We're so happy to have you here, ma'am.
Thank you. Thank you so much. Thank you, Dr. Sharma, for your insights. They were really interesting and intriguing at the same time. Um, I would be quickly cutting short what I had planned to talk about because I have a few things lined up at 6 o'clock. But as Dr. Sharma spoke about anger, sadness, and how they affect our behavior, our thoughts, our emotions, how we go through our entire day, I would want to bring the focus to more positive emotions, the likes of joy, hope, interest, amusement, compassion, gratitude, pride, ecstasy. So, all of these emotions that make us feel good at the end of the day. Um, what I was planning to talk about today was positive psychology, which is this fourth wave of psychology after humanistic, of course. The founder of whom was Martin Seligman. And I wanted to talk about this very interesting model that he had given called the PERMA model, right? P standing for positive emotions, E standing for engagement, R standing for relationships, M standing for the meaning of life, and A standing for accomplishments. Now, if we just break down these five aspects of the PERMA model. Let's look at positive emotions. So, positive emotions being the first element, like I just mentioned, we as humans have this very innate quality of experiencing positive emotions. It's very genetic in nature. But at the same time, we can also experience negative emotions, right? Because of different experiences that we have, or our thought patterns, our perspectives to life. And at the same time, as much as it's very genetic and very innate to our personality, it's also possible to purposefully experience positive emotions. So this is where I would want to talk about the intervention of support systems, relationships, and at the most extreme end of the spectrum, reaching out for help. So there are a lot of people that we know who experience negativity, negative emotions because of, say, for example, negative experiences that they've gone through, some genetic predisposition because of which they are going through a range of mental health problems, physical problems, which can also have an impact of well-being on well-being of a person. Then at the same time, a lot of different personality traits that can have an impact on somebody's day-to-day functioning. Dr. Sharma mentioned about different mental health disorders that can have an impact on our emotions, bipolarity, schizophrenia, all of these that he mentioned. So at the same time, while we might have certain chemical imbalances in our brain because of which we can have mental health problems, at the same time, there could also be certain psychological aspects because of which we experience mental health problems. So at the end of it all, it's in our hand to feel positive emotions, right? And we should always look at the positive side when we're going through immense negativity. The second thing that I would like to talk about is engagement. Engagement means engaging with people around you. So we've often heard that somebody's functioning has three aspects to it: the biological, the psychological, and the social. So we call it the biopsychosocial model, right? So, as much as the biological and psychological aspect of one's life has an impact on how they feel, it's also their social environment. So, one needs to really have a good, solid support system, have engagements with people around them, be engaged with one's own self, and be engaged with the society at large as well. So it's our prerogative to actually focus on who are the people that we engage with. So, for example, you might have a friend circle which is not very good for your mental health and can have an impact on how you feel, how you think, how you behave, what we call good company and bad company. So, again, it's in our conscience, it's in our control to engage with the kind of people that we think would be good for us, we think would have a positive impact on our personality, have a positive impact on our life. The next thing that I would want to go to is relationships. Now, relationships is a bit more personal. It has an immense impact on how we are, how our day to day tasks go by, the relationship that you share with your manager, the relationship you share with your partner, relationship you share with your family, right? How relationships can be a very solid support system as well. And it can make you feel a range of emotions. There are so many people who struggle with relationships and can definitely have or experience negativity because of that. So at the same time, whereas relationships can show us a negative side to life, it can also show a positive side to life, because if you're having a fight with a friend, you can always go to another friend. If you're having a fight with a partner, you can always fall back upon a friend or family, right? So having a good relationship network is also very important. The next thing is meaning of life, finding a purpose in everything that we do, finding a purpose in our day-to-day tasks, going to work, somebody who's studying, going to school, exams, or giving an entrance. Something as basic as the things that we like to do, the things that give us happiness, right? So, if, for example, in this lockdown, there are so many people that we're seeing on social media who are just rekindling with their old friends, or they are reinventing themselves by getting in touch with their hobbies or things that they probably did not ever get time for, right? I've seen like so many people baking breads, or cooking, or at the same time painting and sketching. So these are all hobbies that they are now getting in touch with. Why are they doing this? Because they're finding a purpose in it. When everybody is locked down and nobody has any idea about what is going on, the entire environment is so unprecedented and we have no certainty about what's going on. At that time, finding purpose and finding meaning in the little things that we do is very important. The sale of bicycles and the sale of pets has actually skyrocketed. Why is that? It's because of how these things have provided a meaning for people to live on and carry on during this lockdown. So it's very important to find purpose in what we do. The next is accomplishments, which is the last element of the PERMA model. It's important for us to actually also look at our successes, which can give us a strength, which can give us our strengths and at the same time bring positivity. Because as much as we feel this wave of anxiety, and I'll take the lockdown as again as an example, we feel as if everything is going to go to doom. People have anxiety about what is there in the future, financial anxiety, job anxiety, um, working from home, which is also another new normal that people have to grapple with. In that time, there are very little things to feel good about, feel accomplished for. But those are the things that will actually give you meaning and will help you feel positive about yourself. So, what Martin Seligman actually meant when he explained happiness and well being with the help of these elements was that there is a lot of positivity around us only if we identify it, only if we choose to look at that side of the situation, only if we choose to shift our perspective. Along with all this positivity, we also should be aware about what is called resilience, right? The ability to bounce back, the ability to actually not dwell on just overthinking and letting those automatic negative thoughts, which I like to call ants in our mind, affect us. But at the same time, create your own goals, create your short term goals, take action. Just always believe in yourself and be optimistic about things, because developing this optimism and developing um, a structure for yourself in which you can create goals and look forward to something will again enhance your feeling of accomplishment. It will enhance your feeling of finding a purpose or meaning in the little things that we do. Because what happens is, I know a lot of people who got in touch with me and said that during this entire lockdown, they just didn't know what to do. they didn't have anything to occupy them, no work, no school, grappling and dealing with the new normal was also very stressful. At that time, what really helped them was to create these to-do lists, which they could just strike off. And that feeling of joy when you strike off something of your to-do list, even if it's something as minute as taking a shower or just cooking yourself a meal, or finishing your assignments, or just sending that one email that you've not been able to, or for that matter, reading a book that has been lying on your table for the longest time. All of these things give you a sense of positivity because you are accomplishing something, right? You are engaging with the things around you, because at the end of the day, it's all about positive emotion, engagement, relationships, meaning of life, and the accomplishments that we have. So few things that I would just want to I'm so sorry. Few things that I would just want to talk about. Um, in our life, we will always have ups and downs, right? And these are the ups and downs that we need to actually identify. We need to identify the signs and symptoms that tell us that, okay, fine, I think now I'm going to approach that phase which will make me feel low. And you gear up for that, because at the end of the day, it's that feeling of strength that you get when you bounce back, right? Recognizing that there could be good days and there could be bad days. It's not necessary that you only have to have all good days, because, well, nobody is perfect, right? Acknowledging our thoughts, acknowledging that, okay, fine, something bad has happened. I will feel upset or I will feel low for some time, but then I have to get back on my feet, right? At the same time, understanding that at times our mind has this very strange ability to make us feel miserable, right? And that is when we need to counter it with just positivity, and always tell yourself that there is another perspective, there is another side to the situation. And if you're willing to look at it, if you're willing to get out of the situation, then yes, of course you can, with the help of your friends, family, support system, or always a mental health professional which is out there to listen. After acknowledging, you obviously need to accept it also, and then intervene, bring about a change. Because obviously, when something bad happens, the natural reaction for you is to withdraw. The natural reaction for you is to feel negative about it. But you need to be open. You need to have that kind of um, the ability to accept that, okay, fine, there could be a flaw in my thinking. There could be a flaw in how I am approaching a situation. I should be willing to change. Right? So, our character strengths, which resilience being one, feeling positive being second, um, being committed, being confident, all of these are our character strengths that we can utilize when we have to be more positive. I would also want to just kind of put things into perspective when we talk about awareness, we talk about self-awareness and having insight. So if one has listened to both Dr. Sharma and me, then you have an insight into both ends of the spectrum, the negative and the positive. If one is aware of their own negative emotions and how to actually build onto it and feel positive, then yes, they're more self-aware. Self-awareness essentially is the ability to kind of understand how you're feeling, be more in touch with your emotions, and be willing to change, right? So having an insight, having the awareness that, okay, so this is a situation which I'm not very comfortable with. It's a situation where I might not be my best self, or I don't have the strength to deal with it, is when you actually take a step and not engage as much and speak to somebody, or just think it through in a more practical manner. because our brain has this weird ability of telling ourselves that no, you can do it. And anyway, the generation that we're in, everybody is so self-sure that they feel that they can actually go through any difficult situation without anybody's help. But the fact of the matter is that at the end of the day, not everybody is equipped with the coping strategies that they need to deal with all negative situations in their life, and they might need somebody's help. They might need to reach out to talk to get a different perspective, because that is important, right? And I think I should be wrapping up because I have a session to start in 3 minutes. But what I'm trying to say here, and what I would also want all my listeners to kind of imbibe, is that while, yes, there are moments in our life when we feel very negative, it's also in your control, in your hands, to feel positive about the same thing, only if you understand that how you think, how you feel, and how you respond is all connected. It's like this triangle, which with thoughts here, your emotion, your behavior being the third vertex, and all of them are interlinked. Because if you feel negative, you think negative and you respond negatively. If you think negative, you feel negative, you respond negatively. All of it is interconnected based on our core beliefs. And somewhere, if we change our thought patterns, like Dr. Sharma mentioned, with the help of CBT, cognitive behavioral therapy, and there are a lot of other therapies that we do, because I believe that just one school of thought is not really enough for a mental health professional to kind of help their clients. It's very important that we have a holistic approach towards our thoughts, our psychological well-being, our social well-being, and for that matter, our biological well-being as well. So with that, I would like to take your leave. And I think if there are any questions that anyone has, Rishika, I believe that we can now have the forum open for questions. If there are any questions, I can probably take them for about 2 to 3 minutes, and then I would have to, I'm so sorry, but take your leave.
Yes, so thank you so much for whatever you've said. It really made sense to me, especially the PERMA model. It is really something to live by. And meanwhile, I would ask our audience to ask us questions on the chat box, so we can quickly do a question answer session round, because unfortunately Ms.Nishtha Narula has to take her leave. So just put in your questions. I do have some questions that we previously asked in our registration form, and I would like to ask one of those. So I would like to ask this to you, Nishtha ma'am, that it's said that being sad sometimes is good, but how to draw the line between good amount of sadness and dangerous amount of sadness?
Right. A very good question, Rishika. And I would just say that we know what happens is there's a difference between mental distress and mental illness, right? Everybody gets stressed out. So similarly, there are times where we feel very sad, and sometimes it goes on for days, and then we feel that, do I need help? This is getting concerning. So when a particular emotion, it could be any emotion, when it starts affecting your day-to-day functioning, when it hampers your personal life, occupational life, social life, that's when you should figure out, when you should understand that this is like an alarm and I should reach out for help. Also, sadness can also be confused, and often being confused, with depression. Depression is a mental illness with clear-cut symptoms, and there is criteria in the DSM and the ICD according to which we can distinguish between sadness and depression. So I hope that answers your question. But for anybody, if you feel that any amount of stress is hampering your day-to-day functioning in any sphere of your life, then that means that you should reach out to somebody.
Yeah. So we'll take one more question, and for you, Nishtha ma'am, and we won't keep you here for long. So, I have one that says, how can positive psychology be used to its maximum potential for palliative care?
Palliative care.
Yeah.
Right. Yes, of course, positive psychology works really well with palliative care because in that moment, when you're in that phase of life, struggling with some of the other illness, feeling, because obviously at that time you can't tell a patient to just be assured that they're going to be all right, because they might not be. So in that moment, looking at the brighter side of every situation, feeling positive emotions, thinking back on your accomplishments, finding the meaning of life, right, engaging with people around you, having your support system next to you, and being assured that you're not alone. So, in that moment, positive psychology can be really beneficial because, well, we can't really do CBT on them, or we can't do DBT on them, or psychoanalysis for that matter. But yes, I think it's not just about one field or one way of dealing with somebody. I think one should always have an eclectic approach, which is just a combination of all of these, picking up the most appropriate ways of working with the client according to their needs. That's important.
Yes, that surely answers the question. So we'll take up the questions for for Dr. Sharma in a little bit. I would just like to thank Ms. Nishtha Narula for being here. It was
Thank you.
extremely great to have you, and it was really great for us to hear both a biological side as well as a psychological side to the same emotional spectrum. So we had
Thank
a
you.
spectrum of two kinds, and it was great having you.
Thank you so
Yeah.
much. Thank you, Rishika, for organizing this. And uh, I'll just take 2 more minutes. I really want to thank you. And it's very fulfilling and heartwarming to see young people like you who are advocating mental health and doing so much in this field. Because, with the shortage of psychologists and mental health professionals that we have in this country, it's very important that, the young minds advocate it and help spread awareness, end the stigma, instill empathy and compassion, because I think that's the way forward. And it's always so. Fortis Mental Health does a lot of this work, and I think you may be aware of that. So we believe, and our vision is the same, that we should look at preventive mental health, right? Spreading awareness, letting people know that this is something that exists. And if you feel that you're going through something, then there's always help available out there, because there's so much of stigma that people really don't want to talk about it, right? And I would like to take the opportunity and also mention that Fortis runs a 24/7 helpline, which is available in almost 16 languages. And people can call any time of the day, and psychologists who are working, so like me, my colleagues, all of us, we're on the helpline. So rest assured, everybody can be anonymous, talk about their feelings. It's a crisis intervention helpline. And with Suicide Prevention Month coming up next in September, it's very important that we talk about mental health so that we can save lives and we can make lives better. I would just be putting in the number of our helpline, and anybody who wants to reach out to us for any kind of problems is most welcome to.
So we thank Fortis Hospital for doing this with us, and it's really encouraging to hear that people like you really want to help us and be part of our workshop. So really, thank you.
Thank you so much. And I will take your leave. Thank you, Dr. Sharma. It was nice being your panelist, being on the same panel with you, and hope to do more of this with you, Rishika.
Thank you so much, Ms. Nishtha. It was a pleasure sharing the
Thank
panel with you. And like you said, we'll see you soon again with some more interesting topics.
Yes,
Yeah.
perfect.
Okay.
Thank you.
Thank you. So Dr. Sharma,
Yes.
we do have some questions for you. So we'll quickly take up these question answers, right? So
Oh,
one
yes.
of the first questions that we have is that what is the difference between anger and hurt?
Tell me, Rishika, I'm sorry.
Yeah, the question is, what is the difference between hurt and anger?
Well, if you look at the psychological perspective of these words, they have they usually grade each emotion into different severities. So when you look at the positive spectrum of emotions, they try to put it as happiness, joy, cheerfulness, and then a euphoric feeling. So similarly, when you see at the negative emotions, they put it at maybe anger or hurt, or that feeling where you want to end your life, or you want to end somebody's life. So scientifically talking, I just see them as two different words. I see anger more of an expression, which is talking about some changes happening inside the brain. Like I said, there are some particular centers that are activated during that particular emotion of anger, and these centers are creating some neurochemical changes inside the brain. So that is where I try to put anger at a more severe level, or at a level where a change is happening inside a human body.
Yes. So I hope that answers your question. And we have another question. We have that, what to do when a person in a really bad family environment creates frustrating emotions and depressive thoughts.
Well, this is something that we see on our day-to-day basis also, because unfortunately, somebody facing all of that at that age does not know that it is impacting them. And a lot of times we even realize that, these things could be impacting them at a later stage, in situations like PTSD, where the
Yeah.
trauma has taken part at a very younger age, but now, after many years, they start reliving them, and, it is affecting their emotions. They start avoiding situations. It is giving them disturbances in their biological functions. So, like I was talking even previously, I think one of the most important aspects in mental health is to accept what is happening. So, we need to understand, be aware that this is something negative. These thoughts coming into us is not us. I think this is where a little bit of the philosophical approach also helps, where I try to tell people that you are different from your thoughts. Your thoughts can be good, your thoughts can be bad. See, just like how I say, this is my hand, this is my pen, this is my book. No, this is not me. So similarly, my thoughts are not mine. So though it could be, you know, a clever way of using the language, the philosophical approach speaks about the concept of me being the soul. Now, when you're looking at this trauma, has the trauma really happened to me? The trauma has happened to the body. The trauma has happened to the brain. The trauma has happened to the surroundings, but the trauma has not happened to me. So that is a philosophical way of seeing things, and this philosophical approach has been helpful in not just people having traumas, which are affecting them at a later part, even in the present, when people are discussing about situations like OCD, where your thoughts are obsessive, your thoughts are repetitive, your thoughts are intrusive, and they're not in your control. When people are talking about depression, you're having these negative ruminations that are going on coming. You talk about anxiety, where there is excessive fear, and that thought is not coming out of your head. So this applying this phenomena has been helpful one. Second, when you talk about it again through therapy, thought journaling is one of the most important aspects which we teach our patients when they have these thoughts that are disturbing. Now when you're talking about an incident which has happened, it is in the form of thoughts that is disturbing them at this point. So one, writing down those thoughts is one of the most effective ways in helping them resolve those thoughts. A lot of people, especially in the newer generation, they question me, uh, this looks more of an old school, this looks like a conventional method. We've stopped writing our notes itself, why would we write down the thoughts? So I tell them that I don't mind if you're writing down in your iPad or in your mobile phone, but write it down, because once you're writing it down, it is almost as good as talking to somebody. Because surprisingly, I see it in my hospital. Sometimes somebody walks into the cabin, They introduce themselves, they start talking to us. After 20-30 minutes, they suddenly say, doctor, I'm feeling fine. So I haven't even done anything there. I haven't even uttered a word. I've not even planned any kind of treatments for them. So ventilating your thoughts itself reduces the burden. And I remember a very young girl once expressing how well she feels, and she says, I'm feeling as good as how good I feel when I remove my school bag from my shoulders and put it in that one corner. So you feel like relieving a lot of weight from your head, by talking it out or by journaling your thoughts. The second most aspect about journaling thoughts is once you write down your thoughts, we teach you how to actually look at alternative ways of seeing that particular situation. A lot of times, what happens is because of these experiences which happen in our childhood, we make some permanent impressions of a particular situation. Like, I'll give you an example. There was this husband and wife who had walked into my hospital, and that wife started complaining that, they're having some marital issue. And then she told me that he goes out with his friends in the weekend, and that is what troubling me. So maybe I thought, she's not comfortable with the gender of the friends or the set of the friends or maybe the habits that they have. But that was not the issue at all. Then, for a point, I did not realize what exactly could be the reason. She says my husband is amazing. She says my husband gives me all the time. She says my husband is very sweet. But, I, don't like it when he goes out. But now, when you start looking at what exactly happened in her life, what we realized was at a very young age, she has seen her parents getting divorced. And before the divorce, the mother and the father spent a lot of time separately, away from each other. So now that particular incident, though it has happened almost 2 decades before, that thought in her head is, acting upon her behaviors today, acting upon her emotions today. And today, when the husband is spending time away from her with friends, she starts feeling that her husband is going to leave her. So this is, these are called as, you know, automatic thoughts that come into your head, which, Ms. Nishtha was also talking about. And identifying these automatic thoughts, being automatic thoughts are thoughts that are illogical. So identifying that there is an illogical thought coming into your head and finding out the reason why that illogical thought is coming, the schema that has happened in the childhood, all of these are going to change the perspective of leading the current life. And at the same time, I spoke about a few techniques because now, in the current scenario that you've given me, you cannot really change what has happened. But now, should we be giving that incident so much priority that it impacts our current life? Is what we need to decide. And if you do not want it to impact, but if you still feel that it is intrusive and coming into your life, that is when concepts of mindfulness again walks in, because you are gaining that ability to cut off from the past and live a meaningful present. So there are different approaches to it. It's not just about the philosophical approach, it's not just about the CBT, it's not just about mindfulness, but like Nishtha was saying, there are different approaches that we believe, all, like, one particular, set of clothes don't fit all sizes. So, we have to choose what therapy helps them, what is the state of mind of that patient. Now, with the same scenario that you said, somebody might come and say, I want a solution. Somebody might come and say, I don't think there is any solution. Somebody might come and say, because this has happened, I want to end my life. Now, at what state they are in going forward with the treatment is what we need to understand, and that is how accordingly we deal with it.
Okay, I think that was a very elaborate answer, and I'm sure they must have gotten what they wanted to hear. We would like to close off the floor now for questions, and I would, whatever you said about our thoughts not being us, but thoughts being a separate thing for us, really made sense for me that I am not my thoughts. And that's really helpful to use language in that way to understand how you process sadness or how you deal with your emotions. I would like to again reiterate that you talking about the biological side of it and Nishtha ma'am talking about the psychological side of it, really gave all of us a deep insight into how to understand our emotions, how to look at those emotions from a very diverse point of views, and together from the knowledge of both bio and psycho point of view, we can how manage these emotions. So it has been a really insightful and a really fruitful session, and we again would like to thank you so much for doing this with us. We
Thank
really
you so
think it
so
was
much,
great.
Rishita. Thank you for giving me this opportunity. And like Nishtha was also saying, I think it gives us immense joy to see somebody as young as you all to start off a platform like this, which is the need of the hour. It is so unfortunate. I always keep telling people in the last 6 months, with all the information people have about COVID-19. Today, you even ask a 5-year-old boy why he's wearing a mask. He's at least able to say that there is a virus and there is something called as
Yeah.
corona. But it's unfortunate that a lot of people of different age groups do not know much about mental health, and that is what causes a lot of stigma. I see a lot of people coming down with myths about medicines. People talking about medicines as if they are going to kill them. People talk about therapy as if it is just a waste of time. Why should I be sitting and talking to somebody? But I think a platform like this, I think interested people like you coming up and starting something like this gives us a lot of joy. It makes us feel secured, makes us feel that mental health is secured in the next generations. And this is something very interesting, and I feel really nice to be a part of this. Thank you so much for giving me this opportunity.
Thank you so much. So kind of you. So, guys, if you have more questions, you can follow Dr. Sharma and Ms. Narula on Instagram. And if you have some questions, I think you can directly ask them. And we really thank you all for being here. Emo Diet does have a few more workshops, and we do these every Saturday. So, if you want to know more about our art therapy workshop that we're doing next Saturday, you can just email us on the email ID provided in the chat section, or you can just SMS or DM one of us. So thank you all for joining. Thank you, Dr. Sharma.
Thank you.
Yeah. Okay. Bye, everyone. Thank you.